This is Brent of the Brookbush Institute, and in this video we're going to go over upper limb tension tests. I'm going to have my friend Yvette come out. She's going to help me demonstrate. Now these tests are to help us determine whether the median, ulnar, or radial nerve are involved in our patient's complaint. We could see these as trying to find the concordant sign as part of some nerve dysfunction. Usually we're using these tests as part of a cervical radiculopathy cluster, and we'll be going over that in a later video. Now the first thing we want to do with these tests is notice that the patient's in supine, laying flat. We don't want to add any tension to the nervous system, for example, by bringing ourselves up into hip flexion and hook lying. We want to make sure that the head's nice and neutral, that we have a stable position we continue to come back to, and then we're going to ask, hey, how is your neck feeling right now?
Fine.
If somebody has a cervical radiculopathy and it is irritable, you'll be surprised. Sometimes people will get a little nerve symptoms just being flat back with their cervical spine a little bit in extension. So it's important that you kind of rate your starting symptoms so you know if the tests actually change them. Now, what we're going to be doing with these tests is essentially stretching nerves. Unfortunately, nerves are a little bit more complicated than muscles as far as trying to stretch them, because they go around so many other joints and have so many ways of relieving tension and gaining tension depending on what movements are added. So it gets a little complicated. These are going to take a little bit of practice. But all of the tests start with this little bit of scapular depression. And as you can imagine, if you think of how those nerves run, right, off of the brachial plexus, this would stretch the brachial plexus. So we just want to start out with, hey, did that increase your symptoms at all? Okay, so if we know this didn't increase the symptoms, now we need to start loading the nerve further along. We'll start with the median nerve. And what you're going to do with the median nerve, and what I do, guys, is I usually use my fist here to kind of brace, and then I'll use my thigh to help me support the arm. Right? And then we'll go ahead and with the median nerve bring up to 110 degrees. Right? So right about there, and go, hey, how does that feel?
That's fine.
If that feels fine, we're going to now do this funny hand position thing. Right, you guys have seen these on some of those nerve tension tests, I'm sure, before. But notice how I'm using my pinky to get across all of her fingers. I have good purchase of her entire hand. I'm going to bring her fingers back into extension, her wrist back into extension, and into a little ulnar deviation. And I can ask again, how does that feel?
That's fine.
Okay, and I'm going to bring down to about 90 degrees of external rotation here. That's okay? Mm-hmm. Good. And for most people, guys, even if they have median nerve involvement, they're probably still okay here. Where you usually get things starting to show some signs of symptoms is when you go into elbow extension. Mm-hmm. And right about there, you can see Yvette is starting to feel it. Now, this actually is not abnormal, and that is something you have to keep in mind, is feeling nervy symptoms at, let's say, within 35 degrees of elbow extension is not necessarily an abnormal thing, right? We need to ask them, does this bring on the symptoms you were talking about? And if it doesn't, then it's not what you're looking for. You might also want to compare sides, right? If we're talking about a right cervical radiculopathy and she's the same on her right and her left, well, then we can kind of determine that this is not as involved. The other thing you can do for all of these tests is try to sensitize the cervical spine involvement, or sensitize the test to cervical spine involvement by going, okay, let's go lateral flexion, increasing tension, right? And see if that changes this. If all of a sudden she's like, oh, right? And that brings on a lot, like it magnifies her symptoms, then there's a good chance that we have median nerve involvement from a cervical radiculopathy. You could also go the other way. We could go, okay, let's take a bunch of tension off and see if you get better, right? So now the hard part is you got to make sure you get your hand in there before they get their head down to their shoulder. But if she takes a bunch of tension off and all of a sudden, like, all of her symptoms go away, that's probably a good sign that the cervical spine is involved. All right, guys, so before we go into the other tests, let's just take a quick tally of things that are going to apply to all your tests. All of the tests are going to involve this depression of the shoulder girdle, all right, so that we lengthen out the brachial plexus. All of the tests, you can sensitize the test to cervical spine involvement by either increasing tension with lateral flexion away or decreasing tension with lateral flexion towards, right? Now the median nerve you saw was this funky little movement, right? We're kind of doing this thing. Right, so it's supination and extension of the fingers, extension of the wrist, and then once we get to 110 degrees of abduction, 90 degrees of elbow extension, we got all of that extended in the hand and wrist. Then it's the elbow extension at the end, which is usually where we start to see funny stuff happen. Now, the ulnar nerve test is kind of just in the opposite direction. So rather than supinate, we're going to pronate. Rather than extend the elbow, we're going to flex the elbow. All right, you guys with me? So here's what that's going to look like. You're going to, again, depress the shoulder. Hey, how you doing? Everything's okay? Yeah. Cool. Back to 110 degrees. You okay? Mm-hmm. Good. Now watch. Boom. I just went in the other direction. Right? How's that feel? All right, sometimes you get a little funny stuff. Make sure you guys get the pinky on this one. Mm-hmm. Right? So make sure you get the pinky extended too. And then what am I going to do? Flex towards her head. All right? This test is almost like if you thought about doing this. I don't know if you guys ever tried to make that face. I can't do it. Evidently, I have some ulnar nerve. My ulnar nerve is not as extensible as some other people's, but if you think about this test for ulnar nerve, and you think about this for median nerve, you're getting close. Then it's just a matter of practicing enough to get your hand position comfortable, right? And you guys can notice here that, again, I'm using my thigh to help. Now, the last one we're going to do, which is a little different, is the radial nerve. Now, again, start with depression, okay? How does that feel? That's okay? Mm-hmm. Now, in this one, I'm going to ask her to hold her thumb. All right, so she's going to do this. Because we want thumb flexion. I'm going to totally internally rotate and pronate the forearm. Right? Internally rotate the shoulder, pronate the forearm. Hey, how does that feel? Fine. And then the last step, and again, I use my thigh to help me maintain some elbow extension here, is we're going to abduct her kind of locked out arm. How does that feel? Now, once again, guys, feeling nervy stuff, you know, like the little tingly or the little shock, once you get out like here, is actually pretty normal, right? So let's not make a positive out of something that's just normal uncomfortability. Keep going back to, does that bring on the symptoms you were talking about, that concordant sign thing, right? That was actually fairly normal extensibility that she felt. We saw she had fairly normal extensibility on the median nerve test. The ulnar nerve test, she actually had almost like, she had great mobility throughout that position and had no symptoms at all. So far with Yvette, we're seeing negative involvement of her median, radial, and ulnar nerve, right? So let's go over that last one more time. Neutral position. Her hand was down by her side. I had her tuck her thumb. I'm going to internally rotate. You can kind of look at internally rotating everything, right? So pronation, internal rotation of the shoulder, flexion of the wrist, and then I pull out into abduction. Checking all along the way. How do you feel? Fine. How do you feel? Fine. How do you feel? How do you feel? Fine. Good. Better to be annoying than to not ask. Because if she was brought on symptoms here, but you didn't ask until here and then thought she was normal, that's going to give you a false negative. Right, now, could I sensitize this test? Absolutely. Can you laterally flex your head away? Good. All right. Did that make things worse? No. Can you go the other way? Did that make things better?
Yeah, it's fine.
Yeah. It's still fine. Yeah. It's still fine. It didn't actually make her symptoms better. She's just saying she's still fine. All right? So These are going to take some practice, guys. And these are some of those tests where, let's be real with each other as professionals. If you haven't done them in a while, chances are you're going to have to look them back up. So this might be a video that you want to highlight. I definitely have to look them back up every once in a while because, you know, if I go a little bit of time without seeing a cervical radiculopathy, there's no reason to necessarily do these exams. You're not going to do them with everybody who walks in the door. Now, we said that all of the tests start in the supine position. All of them start with a neutral head position. All of them start with depression. And then the only thing you have to remember is what movements you're trying to create. So are you trying to do this? Are you trying to do this? Or are you trying to do this? All right, if you guys can remember that, you're in really good shape. If the next thing you can remember is that elbow extension and elbow flexion are probably the keys for the median and ulnar nerve tests, and abduction is the key for the radial nerve test, as in those are the movements that generally give you an indication that this is a positive test. You've now taken it one step further. And of course, when you have complicated things like this, as we've said in manual therapy videos over and over again, do me a favor, practice these on your colleagues first. Colleagues who can give you some feedback on how it feels, so that before you do this on a patient and look like, you know, Muppet hands and just have no, you're like, I know it's supposed to be something like, no, you want to be confident in the way you look with these, right? You want to be able to go right into the position and know whether or not you've loaded this nerve, and that takes just a little bit of practice. If you guys have any questions, leave it in the comments box below. I look forward to hearing from you.